Hi, everyone. It's Jessica Martin here with Martin Management. I have my husband, Tony Martin, here with me today to talk a little bit about the clinical side of the dental spa approach. Now, this was something I didn't anticipate. I knew that if we put amenities in place for patients to help calm their sensory system, that they would experience a better dental visit. But I had no idea how it would have impacted the doctor positively. So, Tony, share with us a little bit about what surprised you or what's come about from the dental spa approach for your clinical side of things.
Sure. So I guess the first thing that comes to mind is a relaxed patient is generally more accepting of care that they absolutely need, and also is just generally easier to work on. I found that patients that come into our office that get the little extra kind of treatments, pillows, blankets, neck wraps, etc., they kind of get a little bit more relaxed right away. And with our general demeanor and how we approach the new patient experience, I find that they're more willing to accept, treatment that they've been deferring for any length of time. And actually, once you get them to the treatment appointment, just basic dentistry like injections become easier. Patient is more relaxed, so they generally aren't as tense when you're treating them. Just the overall appointment times get shorter and more efficient because the patient is just more relaxed, and it just becomes easier as a clinician to treat patients that are relaxed versus anxious, apprehensive types of patients.
Yeah, I always kind of tell doctors that it doesn't doing all these little extras. It sounds like in the beginning, like it might take longer, but we have never increased appointment times to fit in the dental spa amenities. And what we found, which is what you're talking about, is that it's actually become more efficient because the patient's more ready to accept treatment. The blocks are easier. You're not having to check in as often because you can tell non-verbally that they're doing better and they're more relaxed. So it actually can stream up or tighten up those appointment times, which obviously affects production and how many patients you can see in a day, which is great.
Yeah, definitely. The dental assistants and the hygienists are very much involved in all of these extra services and sort of procedures that we implement with the spa approach. So the doctor is not actually the one who's burdened with all of these little, add-on types of procedures that let the patient feel more relaxed. It's really your clinical team that are the ones that are taking care of these things for the patient. So by the time you walk into treatment room, patient's ready to go, they're relaxed. You can, introduce yourself, or if they're an existing patient, you just, ask them how things are going, et cetera, and pretty much you're ready to roll.
Yeah, I'm glad you brought that up because, it really doesn't change. It doesn't have to change what you're doing at all, right? You're not putting on the neck wrap. You're not doing a mini massage. You're not giving them a blanket. Your auxiliary staff's getting all that set up for the patient for you. And then you're able to just get in there and do dentistry.
Exactly. That's how a practice can grow with both efficiency and just word of mouth referral, because the patient is essentially getting more than they expected at that every treatment appointment.
Yeah. So we also have I call it a comfort questionnaire, but developed a set of questions that upon intake, when we're getting to know a new patient, we really want to understand if they do have some dental anxiety and what those triggers might be. And so can you talk a little bit about how you've utilized that form to really help with case acceptance and just understanding the patient in general?
Definitely. So the usage of our comfort form, which is a multi-point questionnaire, more or less trying to triage past dental experiences or traumas that they've experienced, any apprehensions that they have about specific procedures, seeing instruments, fear of needles, just general types of questions that sort of pull out some answers out of these patients to kind of get a feel for, have they been avoiding treatment for any number of years because as a child they had a traumatic experience, or even as an adult they did, or they've had extensive dental work previously and things that haven't gone well, whether it's failed treatment, previous clinician somehow wasn't kind enough, or something to that effect. It's a really useful tool to understand their previous course of treatment, what their triggers are as far as fears, and really building a trust and rapport with the patient so that they know that you care more than they care more about how much you care than how much you actually know. So they're more willing to, trust you and accept treatment because they know that you care and are interested in what makes them tick and what they fear.
Yeah, and haven't you been able to build some really cool cases from that questionnaire? Like, I think at the bottom, I always put like any concerns that you have, and some stuff's come out of the woodwork that maybe the patient wouldn't have disclosed, and you were able to build. You remember that one case? I'm thinking of in particular. It was like a really extensive. I don't know if it was a social 6 redo or something that came from that questionnaire. The patient was like, actually, I do want to talk about that, but they wrote it down. I don't know if they would have disclosed that to you.
Yeah, I don't recall the case specifically, but that is a consistent finding with the questionnaire is, they might say, well, I had such and such treatment completed and this didn't go right and this is what happened and the doctor didn't explain this very well to me, et cetera, et cetera. And it really kind of allows you to pause and think about, okay, this didn't go right for this patient. This is how we're going to address that issue and make it go better next time. So.
Sure. Awesome. I just was talking to a dental office earlier this week who was saying, most of our patients really aren't anxious. So we're not really sure that this would be an approach that we would need. And I kind of laughed because, statistics say that 60 to 70% of the population has some level of dental anxiety. And what was interesting in our office, because we were an existing practice that put this in place, like most offices, and we actually polled our existing patients with the questionnaire. And we have a different questionnaire that we use for existing patients versus new patients, but just said, hey, like, we're doing this new thing and we want to get to know a little bit more about your dental history before you came to our office. Can you fill this out? And so many people that we thought weren't anxious, that present really calm and hold it together really well, disclose that they actually were anxious. And then we were able to help them through that with, we have these amenities and these strategies, and they're like, oh, well, this is way better. I've just been kind of being a big girl and pulling it together, but I really was anxious. So have you noticed that as well in the chair?
Most definitely. And then what you've essentially done is created more trust than what you already had with that patient, and they're more likely to refer to you. So now that you've essentially broken down the barriers of care, even though they may have been an existing patient and you had no clue that they were as anxious as they might have presented, now that they understand that you care enough to know these things, they're, a good patient becomes a great patient because they're likely to refer to you at that point.
Absolutely. Well, and really, the problem isn't the patient and the person being anxious. The problem is dentistry and how we're doing things, not meaning to, but the dental environment from a sensory perspective is really negative. And so that's why these things are so important, to really calm the sensory system and create a better experience. So anything else you want to add, Tony, or we'll be done?
No, I think that pretty much covers it. So thank you.
All right. Thanks. Bye-bye.